2020, which resulted in about 41,000 cumulated cases. And our highest peak point was about 1,358 from the data I was trying to look at,
Okay.
with about 270 deaths occurring. So, so normally when you are in the peak phase, there's a lot of things that you do, including lockdown, social distancing, alcohol, sanitizing, restriction of movement, and all that. If you decide not to do anything, you will still go through a decline phase. So, two
Right.
things that many people do: either to leave the virus, to go through its natural course, and then gradually descend or decline.
Okay.
But if you allow it to do that, it's going to kill many people. Like the UK tried when the whole thing was starting, realized that many were dying, and therefore decided to change their strategy. The next strategy is that when you see that is rising, you begin to put in some measures,
Okay.
which is the physical distancing and all the things that we talked about. But in Ghana, you know that when it started, we had lockdowns and many other activities that also helped in a way. And we're able to reduce our cases down to about 50 to 100 as of December 31st, December 2020.
Okay.
So things were quite good as at the end of last year. But the beginning January of 2021, due to the Christmas activities and many other social interactions,
And the
we also
elections.
some rise in cases.
Campaigning and the elections.
Well, many things: elections, campaigning, social interactions, Christmas festivities. Also contributed by variants that came in. Remember that within the first instance, many of the cases we had were due to the earlier Wuhan strain that came from China, a
Okay.
very original one. But then from January of 2021, we started dealing with the Alpha strain, which is the UK strain that we know of.
Okay.
So that is what actually contributed to the many cases that we had from January to somewhere in April. So as at March, we hit our peak phase with about 700 new cases occurring in March.
Okay. We're
And
now talking about, sorry, Doc, we're now talking about March 2021.
exactly, what is the
Right.
second wave?
And the
Yeah,
predominant variant there was the Alpha, the UK variant.
yeah,
Okay.
yes. What we have in the UK era. So this took us to cumulated death of about 743 deaths, which was quite high. As at April ending, we hit the decline phase once again, and we went down to about 50, and close to 20 cases, new cases occurring.
Okay.
Although the deaths also reduced to some extent. So again, things went back to normal, and many people thought that, well, we are fine now, especially when some have taken their vaccines and others feel that they are also okay. But
Right.
then, any part of June, that is when we started also seeing some few cases coming up, and then gradually increasing. But before this, countries, about 14 countries in Africa have started raising the red flags of increasing cases occurring, which is mainly due to the Delta variant or the Indian variant, as we call it.
Okay.
Because we saw what happened in India, and we knew that India constitutes large population in this world, about 1.2 billion, which is almost close to the African population. So
Joy
just as we had
99.7
outbreak
FM.
starting from China, which also had a similar population, we knew that it will eventually get to the entire world.
Okay.
So when India recorded their Delta variant, many people knew that it will eventually get to everywhere because of the large numbers and because they're also everywhere. But in Africa, most of the Indians are in East Africa. So it wasn't surprising that the East Africans began to record their third wave much earlier than many of us. So
Right.
places like Uganda, places like Kenya, and its neighboring countries began reporting the severe cases and deaths also occurring. And then eventually parts of Africa, Central Africa, and parts of West Africa also began recording new cases. Also in South Africa, especially South Africa, Namibia, and its neighboring countries also began recording new cases as a result of this Delta variant we have. So
Right.
as we
Doc,
speak now,
Doc, can I just get you to clarify for my listeners the spread of this Delta variant, which originated in India? Are you suggesting that this spread is inevitable? It was bound to happen. It wasn't preventable.
Yes,
The world could
you
not
know,
have contained the Delta variant or any variant.
no, you cannot prevent it. And
Okay.
this is how the virus, no matter how much you do, and no matter how much you put in
Joy
I mean, at
99.7
the
FM.
airport and whatever you do, you can't prevent it. What
Okay.
you do is that you can slow its transmission
Okay.
and then reduce the impact. And this is what many countries do. Like for instance, in Ghana, because of the stringent measures at the airports, I think this current third wave should have occurred a month or two ago,
Mm.
when the Kenyans were experiencing their own. But some of the measures we put in place delayed this a bit and then allowed this to gradually flow through the system. But if we were to also put in some strict measures in terms of people behavior and interaction,
Right.
we may not experience what we're experiencing now. Because the PCR test and all the other antigen tests at the airport are good. But if you test 100 people and they are positive, you should expect that 2 or 3 of them will slip through.
Okay.
And when 2 or 3 people slip through and the people in the community are not following any protocols, it's only a matter of time.
Okay.
And many of them are infected. So this is where we are now. And as soon as we got indication that Ghana has recorded community transmission of this, it means you can't do anything again. Now you have to begin taking activities and taking actions that will enable you to not to get to the peak, or even if to get to the peak, they have to flatten such
Right.
that you don't have the full impact of this.
Okay.
So
Doc,
this is how things have evolved.
okay,
And
that's
this
where
is what
that's where we are now. Right. If you've just joined us, it's 18 minutes past the hour of 2 on Joy 99.7 FM. You just heard speaking Dr. Michael Owusu. He's a virologist with the KNUST and the Kumasi Center for Collaborative Research. He giving us the breakdown all the way from March 2020 when we experienced our first cases, and then we've had a couple of peaks and spikes, right? He suggests that the decline can be the normal progression of a virus and also a response to, should I say, significant interventions which Ghana undertook, right? From January, we saw a spike again. We went all the way up, and then by April, we started coming down. We've started seeing a significant spike again, and we need to take cognizance of this and its implications. So you just heard Dr. Michael Owusu. I have been joined on Zoom also by Dr. Christian Owu. He's a senior lecturer and consultant at the Department of Anesthesia, University of Ghana Medical School, and he's also the National Case Management Coordinator for Severe and Critical COVID-19 disease and the clinical lead at the Ghana Infectious Diseases Center. Chris, thanks for joining us. Are you unmuted? Chris, can you unmute?
Yeah, good afternoon, Nortey.
Afternoon, Chris.
Good afternoon, Michael, and very good afternoon to your audience, to your viewers this Sunday afternoon.
Right, Chris. When I bring in the macho frontliners, then it means I'm significantly concerned. I think the last time we spoke to you must have been May last year, if I'm right, where we were celebrating. We actually did a pause for applause, where we celebrated the wonderful team and the work they were doing. Unfortunately, or sadly, Chris, we're back to basics, and there's a frightening spike in our cases. You've just heard the tale of the tape from the virologist. What's it looking for you? What's it looking like for you at the frontline critical care centers? What is it looking like? Because we've heard, should I say, different reports and accounts. Some of your team are saying that critical centers are overwhelmed. And we're also hearing that this is not the case. What is it looking like at your perch point, Chris?
All right, thank you. Once again, last year, around just before this time, we had that discussion, and then I enumerated what interventions we had put in place to try to mitigate the impact of this pandemic on the Ghanaian population. As you and your viewers could see, most of those interventions with respect to clinical management of cases and preventing community spread did bear fruits. Because obviously at that time we did not have vaccines. We did not know when vaccines were going to come. So we had to use the tools that we had at that time. We've already had 2 waves of this pandemic, and then other countries are already on their third wave, and we are beginning our third wave now, and in Ghana. Um, now, it is important to bear in mind, and this is not controversial, that as your number of cases of infection goes up, your number of severe and critical cases will definitely go up.
Okay.
It is not controversial. There's no question about that. Everybody knows that because it is a percentage. Actually, what is the issue is what percentage will it continue to be? In the first wave, there was the impression created that Africa was spared, where then we were contributing between 1 to 3% of total global infections.
Right.
As we could see at the moment, with over 180 million people cumulatively having been infected, Africa has not gotten, is actually yet to approach 10 million. So cumulatively, that had been lower, and that was mainly during the first wave. Obviously, with the percentage severe critical, what it meant was also that our numbers were lower, and then the mortality in Africa was lower. Now, in the second wave, with the virus becoming much more intelligent through mutation, the impact of the second wave, even though it was shorter between end of December and early to mid-April, the impact of the second wave was much more severe than the lengthier first wave.
Okay.
The number of infected cases in Africa was much more, the deaths were a lot more. Now, as the Delta variant started circulating from India and then its neighboring countries, we knew that it's a matter of time because we've had that in basically every wave, a different variant circulating the whole world. So as Dr. Wusu said, when Africa started being impacted, which is earlier than with the other 2 waves where we were usually about 4 to 8 weeks behind the rest of the world. And this was, as he said, significantly because of the bigger population of Indian population in Southern, Central, and Eastern Africa. But yes, that it is travel, it is importation. All of us are able to import because, as I said, there's a limit to what you can do to prevent importation. Barring basically locking down economically and way of life for a lengthier period of time, which we have found to bite. So in this wave, with the behavior of these variants, I'm cautiously but categorically going to say that this is actually looking like a significant African wave. Why am I saying so? As we sit here now, unlike the previous 2 waves where we're contributing 1 to 3% of total infection, and note that our testing regimes in Africa has not significantly changed. In a lot of African countries, that had actually come a little bit down compared to the second wave. What we are seeing is that Africa is contributing between around 10% of global new cases every day now, and about 15% of global deaths. You can check the figures. And that is massive. We've never done that before. And we haven't even established our third wave significantly. If the rest of Africa, Western Africa, Northern Africa, eventually have an established third wave, we may be contributing as much as 30% mortality every day of global mortality. We are not in the direction there.
Wow.
It means that we need to take this a lot serious than we have with the previous waves.
Okay. Thanks for giving us the global picture and then translating it to local impact and import. But when I look at our data, I see that when we look at the positivity rate, uh, the contribution or relative or comparative contribution from international travelers is zero point 0.5, whereas our positivity rate for routine surveillance and enhanced contact tracing hovers around 9.9 and 9.5. So even if we took that out, it means our positivity rate is very high. Am I right?
Yes, yes, because we already have a community spread.
Right.
We are not, so that is why, I mean, this is not, as Dr. Usu said, the measures in the airports may have flattened what it looks like in the airport. But anytime you import one, you have an exponential increase in the number of people they're going to spread to in the community.
All right.
Okay, so yes, that is going to even go much higher up. I can tell you some of the testing centers, specific testing centers for walk-ins, are recording much higher positivity rates than even the 9.5% you're talking about.
Okay. Now, let me ask what it's looking like at your facility level. You are heading or coordinating our national response, especially when it comes to critical and severe cases. Something most people don't want to talk about. Everybody is moving around, doing what they want to do. Funerals are taking place, weddings are taking place, church services, schools, institutions are open. But what is it looking like at that downstream critical facility level? We've heard doctors and clinicians say that, hey, Ghanaians, you're kidding with this. We are getting overwhelmed and we are alarmed. And then we hear, official statements coming sometimes from the Ghana Health Service, which kind of plays this down. Can you give us the real deal when it comes to facilities capacity and the current situation on hand? What is it looking like?
All right. So first of all, let me try to first of all say that I don't think anybody in officialdom is playing this down.
Okay.
I think that both at the ministry level, the Ghana Health Service level, and facility levels, everybody is concerned. Everybody has gone through this wave 2 times and are worried and more concentrated on how we can limit the impact of this. So first of all, let me say that I don't think that the intention is to play down the impact of this. Now, so what are we seeing?
That's a relief.
Now, a couple of weeks ago, let me actually say, I think there was a publication on the WHO Afro website, which I authored on the 11th of June, which actually addressed this. And that is more than a month ago. And it was titled Tackling Surge in Severe and Critical Cases of COVID-19 in Africa, because we knew it was coming. We had already seen the flags in Eastern Central and Southern Africa.
Okay.
Now, what is happening is that about 2 weeks ago, our numbers were still down. The ICU numbers, which are the severe and critical cases, which are obviously the most, if I should put it this way, significant with respect to clinical management, were still down from the decline of the second wave. Okay. Then the numbers started trickling up. So I can tell you, about 2 weeks ago, the few numbers you had almost by last week started doubling in a matter of days. Sometimes within 3-5 days, you were doubling. Doubling does not mean that it has eventually overwhelmed the capacity to care for this patient.
Okay.
But we know the trajectory that we are on, and we've been in that trajectory before. So historical wisdom tells us that if we have an established third wave, as most of us think that we are going now, that is a matter of time, a couple of weeks, we would have, if we do not have a lot put in place to reduce the impact, that we may get to where we were in February this year, March this year.
Okay.
So that's what we're looking at. So it's not necessarily, so when we talk about centers beginning to be impacted or overwhelmed, remember that a lot of these centers were repurposed centers general hospitals, our normal non-COVID hospitals, still work, still have significant healthcare load, and therefore a lot of the COVID-specific centers were added responsibility and repurposing of health workers to take care of that. So when the waves went down, part of what happened normally, and there's absolutely no problem with that, is that these healthcare workers would not stay idle. They usually would be sent back to help with the collateral damages that have been done on non-COVID, and some of those centers would reduce their capacity.
Okay.
So at the beginning of a wave, those capacities will not be as high as it was at the peak of the previous wave. And therefore, when you hear that the numbers are going up and are impacting or beginning to overwhelm some of the repurposed centers, they mean also that their capacity needs to start going up. But those numbers are coming from places where they're already looking after patients. And that's why we are concerned, because we'll have to repurpose people to help in the Ghana Infectious Disease Center, in East Municipal Hospital, Rich Hospital, ICU, COVID ICU, Kolebu Teaching Hospital, CDTU, and then ICU.
Okay.
And in addition to the work that we already doing. It is not sustainable if it continues in that trajectory. It does not matter how much we try to sugarcoat it, because eventually the system will be overwhelmed. The system will be overwhelmed not only with respect to human resources, but even material resources, significant among which is oxygen and medicines. So as I speak to you now, I'm actually with a team from Ministry of Health working on our oxygen capacity on as a task from the Minister of Health to continue to improve and enlarge our capacity to deal with both COVID and non-COVID related diseases.
Okay.
But yes, with that trajectory at the moment,
okay.
From what we look at, it's going to get worse. We need to be up in arms. We need to reduce the spread. That is significant, because our vaccination target that would reduce severe and critical cases, we are not yet there.
Okay.
It will take us a little bit while longer to get there.
Right. Okay, folks, if you just joined us, I'll come back to you, Dr. Owu. You just heard speaking Dr. Chris Owu. He's a consultant anesthetist, and he leads the national response. He's coordinating the response, especially with regard to severe and critical COVID-19 cases, and he's also the coordinator at the Ghana Infectious Diseases Center. He's given us the picture raw as it is. Yes, we are essentially and actually in the throes of a third wave of COVID-19. The new variant also changes the profile of that. And we need to repurpose health personnel resources which were thrown at the earlier peak periods need to now be reappropriated, mobilized to make sure that we can deal with this. But he does say with clarity that if this continues, and it's likely to get worse, our response will not be sustainable. So we now need to start looking and talking about other things like our vaccination, our adherence to protocols, and so on and so forth. I'll go back to him for those details shortly. But let me go to Dr. Michael Owusu. Dr. Owusu, the tail of the tape is a bit scary. We've managed to vaccinate, should I say, fully about 400,000, a little over 400,000 people have received their 2 vaccines. And we have a little under 800,000 who've received only the first dose. So largely the population is unvaccinated. Dr. Owusu, what is the implication of this for us? Does it mean that we must seriously and urgently go back to the behavioral restrictions and the measures as we know them?
Yes, certainly. If you know how this virus works and behaves, the virus thrives on susceptible populations.
Okay.
It's like providing fuel for fire. So if you have petrol poured on materials, you have fire around, the fire is going to burn through.
Okay.
So far as you have susceptible populations, the virus is going to thrive and continue through a third wave, can go on to a fourth wave, can go to a fifth wave, and it has free will to mutate at any time and at will.
Right.
So far as susceptible populations are there. So, I mean, many countries have shown clearly with data that the more you vaccinate people, the lesser, I mean, the incidence of these cases become. And also, you have a chance of reducing severe disease and mortality.
Okay.
And you are able to free your hospital space and give some breathing space for your health workers. So, I mean, the best will have been to aggressively pursue the vaccination agenda,
Okay.
and to ensure that as many people are vaccinated. But you see, as we say this, I mean, like Dr. Wu said, for now, it looks as if the health workforce is soaking the pressure and dealing with the cases. Also
Okay.
because most of those vaccinated are health workers. So unlike the first and second wave, this virus, as at now, should be displacing the health workforce whilst increasing the cases at the health sector.
Okay.
But it seems that many of the health workers who have taken their 2 doses are some way, somehow immune, and many are not getting overly sick and not being hospitalized. So
Okay.
we still have the men and the women on the ground who are dealing with these surges coming up. But it is not sustainable. I mean, no matter how many you have, even though they are vaccinated, as the numbers increase, we get to a point where, as humans, as all of us are, you cannot contain this again. So
Okay.
the issue of vaccination is very important, and as much as we can, I mean, this has to be made available for many people to take. It is only this that will help us. But in the absence of that,
Mm-hmm.
I mean, the behavioral factor, which is the mask wearing, the physical distancing, avoiding large gatherings, is what we have to do. I thought that with the experiences in the first and second wave, people will already be accustomed to this behavior and to
Right.
see it as a new norm that we have to live with.
Okay.
But it looks as if many people are eager to go back to the old lifestyle, when is taking off your mask and then doing everything as if there is nothing happening.
Okay.
And that is the danger there. So although we seem to be in the third wave, where people are dying slowly and others are becoming sick, I mean, the disrespect or whatever, I mean, the behavior of people is getting worse.
Right.
People are living the way they want to live and are doing things. So it is likely that this will rather increase the cases, expand this exponentially.
Okay.
And we may be overwhelmed at a particular point in time. And at that point, you cannot reverse it again. When people get infected, they are sick, you can't go back to this. And this is what I think we still have to make people aware.
Okay.
That we need to step up. Our
all right. We know as Ghanaians, we won't step up until we are made to step up. And that is the enforcement of these restrictions and measures, right? We'll come to that. But let me ask you, both of you have suggested and in fact said categorically that this was predictable. This was inevitable. So with regard to our response, did we have to wait to get to an evident, clearly present third wave? I mean, we saw the Delta pick up and spread around the globe. We knew our capacities. We had slowed down on a few things, testing and other things. Policy-wise and intervention-wise, whilst we will whip people in shape to follow the measures, in terms of our national response, did we wait for this to happen, or were we handicapped by way of resources and personnel? I'm just wondering, because if it will definitely get here, what were we doing?
All right. First of all, Nortey.
Yeah.
So let me say that although it may not be obvious what we've been doing in the background,
okay,
at least with respect to national case management, a lot's been happening in the background.
Great.
So as I said, after the first wave and how the second wave came, there was quite.
Oh, looks like I've lost you. Okay, your audio has gone off, Dr. O. Dr. Usu, if you can hear me, let me just come back to you. Can you hear me, Dr. Usu?
Stopping a pandemic wave is difficult.
Right.
Especially when it stretches out this long. It's not as if we've been a super disciplined population even before this, so that you could say that you could call on that attitude or that discipline.
Mm-hmm.
It's taking a lot of enforcement to even get people to be disciplined.
Okay.
And then, of course, a lot of what's been happening in social media with misinformation and the conspiracy theories, especially when it came to vaccination.
Vaccination, right.
So a lot has gone in trying to tackle that.
Mm-hmm.
National case management, what we did was one of the things we recognized from the two previous waves was that our best fits were mainly in Accra, although the Accra was usually the epicenter. And then, of course, in Kumasi and a lot of the other places had difficulties or deficiencies in managing severe and critical.
Okay.
So we set out to actually basically strengthen this capacity. So between the first and second wave, we did a lot of training in the regions. And when the National Infectious Disease Center was operationalized in January, we brought teams from all the regional hospitals and other centers for basic critical care training with the support of Ghana Health Service, Ministry of Health, JPIGO, and USAID. They actually spent 4 weeks with our teams to train and then with the support of partner agencies to provide them with some ventilators and equipment to start setting up high dependency units and strengthening their ICUs in the regions. So a number of this has been done in the quiet because of exactly the anticipation of what was going to happen.
Okay.
We actually spent from January to end of May doing this training, strengthening teams, and then at the moment in the process of cascading down to district levels so that the burden would not mean, as we had in the first wave, a lot of cases being translocated to Accra and then crippling the system.
Right.
So that has been done. But having said that, just as the both of us have said, this is to prepare us, but it does not mean that the impact, if this is unabated, cannot still be significantly more than the two previous waves.
Right.
It can be. Let me add something to this, and that is the clinical behavior of this virus. Yes, we've talked about how contagious this Delta variant is, and then how it's behaving from populations that have rich in Indian population and all that. But the clinical behavior, one of the things that during the first wave was that it looked like the younger age group and those who did not have chronic medical conditions were significantly spared.
Right.
Now, let me say this, and there is enough evidence that this variant is not really sparing the young. We are having significant proportion of people who are below the age of 40 who are on oxygen, and some who have died, including those in their 20s from this particular wave.
Wow.
What we have demonstrated very clearly is that those who have been vaccinated seem to have been spared severe and critical conditions and mortality. I can tell you categorically, because we have our evidence being the center with the highest number of admissions, that not a single person in our facility in GIDC who has been vaccinated has died since we started vaccinating among those we have admitted.
Right.
The proportion that have ended up in our ICU that have received even as their first jab has been in the minority, actually way below 5% of those we have admitted in critical care. And all of them have done well and gone home. Majority of our very sick patients who have stayed long and those who have died have all had absolutely no injection. We have seen this evidence from other countries, and I'll give you an example, United Kingdom. As we speak now, India is not the highest daily population of new cases. It is United Kingdom with over 50,000 new cases every day now, but with the lowest proportion of deaths. So they're having over 50,000 with about 30 deaths in a day, whereas countries that had not achieved their level of vaccination may be having 7,000 with 100 deaths. We can look at South Africa. South Africa is achieving about 15 to 20,000 new cases a day with a mortality of between 200 to 500 every day.
Right.
Whereas UK is basically in the 20s, in the 30s, in spite of.
So the
So there
vaccine
is
is the
more than enough
game
evidence
changer.
now that irrespective of the vaccines that we're using, and UK is using AstraZeneca, we have used significantly AstraZeneca. We have seen evidence of that in our population, that significantly been spared severe and critical disease and mortality.
Okay. Right. If you just joined us, 46 minutes past the hour of 2 on Joy 99.7 FM, we're getting critical information on our new wave. Both my resource persons, Dr. Michael Owusu, who's a virologist, and Dr. Chris Owu, who is an anesthetist and leading the national response, especially with regard to critical and severe cases. Both of them tell us that we are essentially in a third wave, and the last submissions by Dr. Owu mentioned and assured us of the measures that have been taken to beef up our capacity, especially when it comes to severe and critical cases, and also the validation of the efficacy of the vaccine, even if you've had a first dose only, in preventing severe and critical illness and hospitalizations. And he can say for the GIDC, the Ghana Infectious Diseases Center, that no one with that background of vaccination has succumbed to COVID-19. My WhatsApp is active 055 11 11 997, and the phone line also 0302 21654. We can take some questions and concerns. Let me quickly just look on WhatsApp. Okay, I'm seeing political issues, but these are very, should I say, important revelations or analysis that we have to undertake. And then the important issue is our own behavior. How do we get people back to strict compliance? We're seeing commercial vehicles load as normal. We're seeing churches packed. We're seeing weddings and funerals. The behavioral change is something we need to look at. Dr. Owu, if I may ask, what is the situation when it comes to provision of PPEs? You mentioned oxygen and a few other things earlier. When it comes to the material resources, how are we doing there?
All right. So luckily, we had by the end of the second wave, some of the logistics that were being procured with respect to PPEs that had come in had actually been distributed. As at the moment, personal protective equipment are not significantly a big problem, but I say that cautiously because, as I said, we are at the beginning of it.
Okay.
Now, secondly, basically, the other thing is that with those who are in the front line managing COVID-19 cases, there's been a lot of know-how as to what specific. I mean, at the beginning, there was a lot of anxiety, a lot of fear with respect to what should you use, what protects you, a lot of wearing of coveralls and all that. But now there's been a significant knowledge as to what is good for specific activities. So there's more efficiency in the use of PPEs at the treatment centers.
Great.
And because we're using more of activity-related PPEs. Mm-hmm. Now the other, again, with the waves we have had, there's been impact on the ability to procure, and then because of the financial implication of this, of some of that logistics, and medicines are among those medicines, and then laboratory works are among the significant ones that we're looking at. Because again, knowledge-wise, a number of medications have come on board and are on our treatment guides, protocols as a country, because we have shown that they have efficacy. Unfortunately, some of those medications are significantly expensive and currently not on our national health insurance or even regular in our hospitals, or even though they are effective in severe critical cases. So that is where we are with some of those. Of course, as the numbers go up, the stocks are going to be stretched. So one of the things I mentioned that what we're doing with respect to oxygen, even at the moment. So I'm actually in that team at the moment. there are teams that are also looking at other logistics and then planning ahead. We are looking at capacities of our treatment centers. We are looking at capacities of our hospitals, and then extrapolating what the logistic needs are, and then how to procure them at the moment. So yes, we are not in dire straits at the moment, but as if this continues at the trajectory at which it is going, we will need those, especially the medicines, the laboratory diagnostic logistics, and the oxygen logistics to be taken care of significantly to continue to maintain the gains that we have chalked with this pandemic.
Great reassurance coming from Dr. Chris O. And that's important and significant, but it doesn't leave you out of the loop with regard to your discipline and your adherence to the protective protocols. That's an important thing. And he does also talk about measures that have been taken to make sure that we can beef this up. But he also underscores that if this spike is sustained, then we are in for very, very difficult, challenging times as a country. The key game changer he mentions and refers to specifically is vaccination, and our access to vaccines is another thing that Ultimate Health will have to take up. Let me just come to you, Dr. Osu, as we run out of time. With regard to the testing facilities, we perhaps anecdotally say that testing slowed down. But you also need resources. You also have personnel issues and so on and so forth. What's the picture like at the testing end of this national response? Do you have what it takes? And can you weather the storm? You know, in times past, we had backlogs. We were not sure whether we were reporting the data, the test data on time and so on and so forth. What is the picture on your end?
So from our end, we are adequately resourced. You know that initially during the first wave, we had just 2 centers, Gucci, KCCR.
Right.
In the second wave, a number of centers were added. I know as we speak now, there are over 40 testing sites across Ghana. In Ashanti region alone, we had about 6 to 10 sites that are doing testing. So the pressure on us is quite manageable.
Okay.
I mean, as we speak now, we are getting close to among travelers about 100 cases. Community is close to 50 to 100 cases. So on average, we have about 200 cases that we do reports almost every now and then. And we have reagents and staffing capacity that is also available. But just to add one thing, another difficulty with this pandemic as we speak now is one, because of the weather. We are in the rainy season.
Okay.
And the rainy season also comes with some other things, such as other respiratory viruses that could come to play. Most important is the influenza A virus. You also heard that the Greek ministry has reported of the bird flu, the H5N1.
Right.
And this has a potential of also spilling into the human populations. And the signs and symptoms of this influenza A is not different from SARS-CoV-2.
Okay.
So you will expect ideally that although we are testing for SARS-CoV-2, but in those who present with respiratory illness, difficulty breathing, you may also want to look at possible contribution of influenza A, either through the bird flu path or other strains of that to understand what is happening.
Okay.
Because of the weather conditions and many things happening. So this is even the more reason why wearing of masks is very important to prevent you from getting either SARS-CoV-2 or other related viruses as we speak now. So,
okay.
The testing capacity, as much as they can, should be able to also look out for other possible viruses apart from SARS-CoV-2 that could likely make people present like this particular virus. So we'll be able to manage this well and not to get things out of control like other countries are recording.
Right. Thanks for the reassurance with regard to your resource capacity and personal capacity. But let me just ask this. These breakthrough cases and people who have been vaccinated who can still get infected. With regard to the Delta strain and the new peak or new wave we are in, has the symptom profile changed? Because we're hearing of people who didn't look ill but have tested positive. Has anything changed? If we can quickly capture that or explain that for my listeners before we close.
All right. So the symptom uh, uh, profile, it's too early for us in Ghana at the moment to significantly say that that has changed. It is still flu. Okay. But yes, we see people who are presenting with malaria-like symptoms and then who have had treated for malaria and then still feeling weak. Uh, uh, and but there's non-specific symptoms that we have referred to in our case definition for COVID-19 still are the same for these variants. But as the days go by, we will be able to say a bit more as we profile the symptoms of our patients who are walking in to the OPDs. And that is important. We would actually be letting people know if there are any new symptoms. Remember that during the second wave, among the symptoms that were quite predominant or that were quite common, well, unlike the first wave, were gastrointestinal symptoms, diarrhea, symptoms, and abdominal pain and things like that. So we're looking out for similar things with these variants, and we will be reporting on that. But as I said, we are still basically about 2 weeks into this, although it's already looking like it's already on steroids. But we will be reporting more as we find out more in our patients.
Right.
But yes, let me just re-emphasize what you said about behavior. I think that is important for our audience to continue to listen to, especially the young, majority of whom have not been vaccinated.
That's right.
We're seeing them throwing parties, the funerals, clubs, and all that. We believe that there need to be some enforcement of the protocols significantly now. It does not, the enforcement of protocols is not necessarily the same as lockdown, but people need to take responsibility for their actions. Because even if we at the moment are not totally stretched out, if you are on ventilator, that is a very lonely place to be. And that is a significant risk of death for you, even for the young. And we have reported more significant number of proportion of young people getting severe and critical disease from this variant. Majority of them are not vaccinated. Most of them, basically, all of them are not vaccinated. And they are not being very responsible. So I would plead with everybody, it is time to basically taking responsibility, wear your masks, obey your hand hygiene, avoid the crowding, avoid the parties and all that now. Right. It is very important.
Thank you very much. That's Dr. Chris O, National Lead and Coordinator when it comes to critical and severe COVID-19 disease, and is a coordinator for the Ghana Infectious Diseases Center. Many thanks for the positivity and the assurances you give the populace. Nevertheless, he emphasizes and underscores our responsibility for our behavior and our compliance with all protocols. This is not a joke, and the vast majority of us are not vaccinated. So we need to take this seriously. As you can see, Ultimate Health has swung back into the COVID vein again. We relaxed a bit to cover other issues that are health related, but we will focus on this and get back to the experts and the frontline specialists and personnel to keep you covered. So many thanks to Dr. Christian O and Dr. Michael Owusu. Next week, we'll come back and go into more detail on the behavioral aspects and the things we should be doing and observing in our workplaces, our homes, and our communities. Thank you once again, my discerning listeners. I hope you appreciate and bear with me. Today, I did have to let my resource person speak. So I haven't read out any messages or been able to take phone calls because they needed to get this message across. We'll be back next week with another healthy, easy to digest edition of Ultimate Health with me, Nortey by Nature, produced by my producer, Abeku Sankofi. Stick and stay. Sunday Rhythms is up next. Stay safe.